My question is for the Minister of Education. Speaker, I've heard from countless parents, business owners, and students who are concerned about this government's lack of a concrete plan in September. It's like a bad choose-your-own-adventure book. Education should never be voluntary. Instead, a government should provide spaces for students to learn, as they are legally required to do, and make provisions based on advice from health representatives. Students should all be able to go to school with a plan to keep them healthy. One of my constituents, Christina, told me that this is not a realistic plan for parents with families of two parents working full-time jobs. If students are to return with a model that includes 50% at-home distance learning, either my husband or I will have to reduce our work hours. Our income and careers will suffer as a result. Parents have made enough sacrifices during the COVID-19 crisis. Speaker, how can the minister propose a non-plan that demands parents sacrifice yet more?
Minister of Education.
Thank you, Speaker. Indeed, we have asked school boards to be prepared for 3 scenarios out of abundance of caution, given that the member opposite, likewise his leader, will not know the risk assessment according to COVID in 30, 60, 90 days. That's just the reality we face in Ontario. It's a reason why the majority of provinces of the Federation are in the exact same position of Ontario of requesting school boards to be prepared for a variety of circumstances, including online. I've said it before. God forbid we need to go there. We need to close schools again. We were the first province in the country to do so to maintain health and safety. We will do so again if that's the advice of public health. The preference is conventional day-to-day delivery. We put investments in place. We have a training program in place for all schools. And we, of course, Speaker, are making clear that the advice and the decision point to send children back will be made exclusively on the medical advice of the best pediatric doctors in Canada to ensure that every student and every staff member remains safe in the province of Ontario.
Supplementary.
Speaker, this illogical adaptive hybrid model will not reopen our economy, nor is it good for education. The minister needs to plan for students to be there, all of them, safely. Speaker, the stress that London parents are feeling right now is made worse by the lack of affordable childcare spaces in this province. Nadia, one of my constituents, wrote to me saying, "Many women have left work indefinitely to care for children. This must be addressed and actioned upon." Dana, another London mom, agrees. She told me childcare remains the biggest issue and the government needs to address it. Parents are stressed and not sure how they'll manage and feel no reassurance from this government. Childcare and education are fundamental to the operation of our economy. When will the minister give London parents the assurances they deserve and release firm commitments to education and childcare in this province?
Again, the Minister of Education.
Well, Speaker, the member opposite proudly hails from the Thames Valley District School Board, one of the boards in his community. I'm proud to confirm that $35 million more is flowing in his community to ensure students remain safe in September. Speaker, that represents roughly $952 million in total funding for that school board. It's another proof point. The member from Waterloo, likewise investments in Waterloo, in Toronto and Hamilton, every region of Ontario, funding is up. And the reason, Speaker, it is so, is because we recognize the challenges of reopening schools. We also look globally to other jurisdictions who have just done it in the past weeks. We recognize we have to get this right. The single greatest preoccupation of government has to be the safety of kids. And I appreciate full well the impacts those decision points will have on the labour market and on parents. But all of us must, I think, prioritize as the single priority keeping kids safe. And that is exactly what we're going to do, working directly with the Chief Medical Officer of Health.